co-chair of the Progressive States Network. I'm only going to say a few words because this is not my panel. I live in Denver, and I lobbied the organization, which I co-chair, to have this event here because I know Colorado is going to have to deal with the healthcare crisis at some point, hopefully in the next legislative session. Healthcare is obviously a huge national issue, and as we advocate at the Progressive States Network, we think many of the solutions can happen at the state level. That doesn't mean we don't think there needs to be federal solutions also, but as I think the panel will talk about, the states really are the place that we have the best chance of passing real healthcare reform right now. And I think that's critical. A critical piece of this, a critical thing to remember when we have 18,000 people a year who die in the United States because they don't have health insurance. I recently wrote a column. That's what I do when I'm not raising money and organizing around the country for the Progressive States Network. I recently wrote a column about how in the United States Senate, a very, very, very small number of people are represented by enough senators to stop almost anything. I think I figured it out to be it's about 7% or 6% of the population is represented by the 41 senators who can filibuster and stop anything. And that's an important thing to understand when you consider the health care debate. We're always looking to Washington to fix a lot of these problems, but 7% of the population has the Senate representation to stop anything. And the insurance companies and the drug companies have used that to stop real health care reform. And so it's going to be up to the states all over this country to start solving the health care crisis. Other states have already started, and I think we're going to hear about that. In Wisconsin, in California, in many other states, legislatures are trying to expand health care coverage. And I think we have a wonderful opportunity here in Colorado to do that with the commission, with a legislature that seems more inclined than previous legislatures to address the problem, and with a governor who we can say the same about. So I'm going to turn it over to the panel now. I am not Adam Thompson. Adam is over there. I'm borrowing his seat. But I want to thank everybody for coming out to this event. I want to thank everybody on the panel for making time. And I want to thank all of you for using what we learn and what we hear in this panel discussion to go out and really make health care coverage, universal health care, a reality here in this state. Thank you.
Thanks, David. David is a tremendous advocate supporting states, health care reform, and other issues. My name is Adam Thompson. I'm the health policy analyst at the Progressive States Network. Before joining Progressive States, I was working in the Maine governor's office in the state of Maine on the state's comprehensive health care reform that was enacted in 2003 called Dirigo Health. So I have some of that state experience